SouthCoast Imaging is a comprehensive imaging center. We have all of the modalities on site, meaning we do from the simple, like the plain x-rays or chest x-rays, to the screening mammography and diagnostic mammograms. We're the only site in the area that does 3D mammography or does tomo-guided biopsies with the 3D. We have ultrasound, which spans everything from abdomens looking for gallstones to looking for blockages in the carotid arteries to looking for, tears in the tendons. We have CAT scans that we do everything from looking for, problems with the brain if somebody has trauma, to injecting contrast and looking at something as small as the arteries supplying the heart. And we have MRI scanners. We have two scanners. We have actually the largest bore and the quietest scanner, which really helps people who are either large people or are claustrophobic. But the MRI is amazing for looking at musculoskeletal abnormalities. We actually do cardiac MRIs, which can be helpful at looking at areas where there is diminished blood flow or to be able to identify infarcts, particularly in diabetics. Many of our patients come in because they are referred by a physician, although it is their choice on which facility they go to. They get an order from their physician, and then the patients can actually choose which facility to go to. We also have many patients who self-refer. Some of the exams that really lend themselves to being self-referred are the screening exams. For example, screening mammography is frequently a self-referred exam. Patients can come in and have calcium scores, which let them know whether they actually have coronary artery disease. It takes it out of the realm of, I have an elevated cholesterol or elevated blood pressure, and someday I might develop coronary artery disease, to either you don't have it or you do have it. And that can be extremely helpful. We really want to encourage the patients to get involved in researching where they go for their healthcare needs, and specifically to us, their imaging needs. Because we feel like that if patients get involved, it's going to encourage choice, and it will improve quality, and it will lower costs. And the cost is a huge issue right now. I mean, between the changes in the economy the last few years and the changes in all of the insurance, which everybody, including us, are facing, there are many more patients who are either uninsured, underinsured, or have high deductibles, or potentially tagged to health savings accounts or HSAs. And so patients are paying a much larger percentage of their health care costs than they used to 5 or 10 years ago. And then patients can have an incredible range of how much they will pay for absolutely identical services. And just because a service is more expensive doesn't mean it's higher quality. Frequently, they are very equivalent. In fact, what patients don't realize is that when they have insurance, it is not the quality or the cost that necessarily drives the choice of the insurance plan. The insurance companies negotiate with the providers, and it's the clout, the size, the importance of the provider that frequently drives the price that the insurance company is willing to pay that person, not necessarily the quality of the equipment, the quality of the services. So patients need to get involved in checking out, what the cost is, and realize that it can be absolutely a huge difference. One of the things that patients need to be aware of is that it varies tremendously on how the services are billed. If you go to an outpatient imaging center, we do what is called global billing, which means that everything that's going to be done on that procedure is covered in that one price, and you're going to get one bill from us. It's going to cover the cost of performing the service, which is the technical component for the equipment, the supplies, the technologist. And it's also going to include the cost of the radiologist supervising the exam and interpreting the exam. So they'll get one bill, and they need to be able to ask, what is the cost of a self-pay fee schedule for that one comprehensive bill? On the other hand, if they are going to be having the service at a hospital, they need to be aware that the billing is different at a hospital. The hospital is going to bill the technical component, and then they're going to get a separate bill from the radiologist for the professional services. And in order to compare an apple and an apple, they've got to know what the cost is of both of these bills before they know what they're actually going to be charged for the entire procedure. And it's a dramatic difference.